The first 6 months after the surgery, you will be quite swollen. Alright? When all that swelling disappears and decreases, then there is the second phase, which is the readaptation of the skin to the new structure we have created underneath the bone and the cartilage. This second phase takes another 6 to 10 months. It means to see the final result in a rhinoplasty, it takes at least 1 year. It also depends on the skin quality of the patient. If your skin is pretty thin, then the final result will appear quicker. If your skin is darker or thicker, okay, it will take longer, 1.5 years or sometimes even 2 years. After a rhinoplasty, 24 to 48 hours later, the maximum swelling occurs. This big swelling stays or remains 2 to 3 months after the surgery. After those 3 months, we like to say almost 75 or 80% of that swelling has disappeared, but then the rest of the swelling starts to decrease gradually. It means the first month, 2, 3, even 4 months, you may feel some degree of asymmetries or irregularities because of this swelling. After an external approach rhinoplasty, we have to remove the external sutures. We like to do it 8 to 10 days after the surgery, also in combination with the cast on top of the nose. Some patients may feel some bad smell after the rhinoplasty procedure. The inner sutures we place inside the nostrils will dissolve as time goes on, and that's the reason of this bad smell. After the rhinoplasty, it's very common to feel some block area inside the nose. That's because of the crust of dry blood you have inside. The best way to clean that is using some saline solution, like Inspiring, both sides. You can do it as often as you want, at least 2 or 3 times a day. Also, it's very nice to use or apply some Vaseline in the areas where you had the stitches, okay? Also in the inner part of the rim on the nostrils, okay? Because it will help to dissolve the inner sutures. You can use saline solution sprays, but you should avoid those which contains corticoids, because corticoids may decrease the blood supply. Immediately the day after, you can touch your face, you can apply some makeup trying to cover the bruisings, you can apply as well some moisturizing, and if you have big bruisings, you can use the thrombocyte gel to help decrease the resorption of that ecchymosis. If you don't find thrombocyte gel in your country, you can use as well some arnica gel. It's very easy to find anywhere. You can touch your nose, and it's also quite important because then you can help the decrease of the swelling using some gentle massage. You can do this massage from top to the bottom and from the midline to both laterals. This type of motion, because it helps to decrease and to squeeze out the swelling. You can blow your nose, but you have to be very careful because you have to do it in a very gentle way. And it's very important if you have done the rhinoplasty also in combination with the forehead surgery, this is completely prohibited the first 6 weeks. If you want to sneeze, you can sneeze, but then with your mouth wide open. And if you want to clean your nose, you can do it first one side, very gentle, and then the other side, but never both sides simultaneously. You should avoid big crowds or impact sports like boxing, football, okay? Because after the rhinoplasty, your bones are completely healed 2 months later. So the first 2 months you have to be very careful and try to avoid these impacts. You should sleep with the head a little bit elevated, and you can use a couple of pillows. We always recommend to use contacts. If you don't have contacts or if you don't like them, you can still use your glasses, but you have to take into consideration you are placing a little weight on top of an operated area. Nothing will happen. It means you won't break your nose, it won't bend, but you just may feel a little bit of extra discomfort because of the little weight extra.